she's saying, hello doctor, I just entered the 9th month of pregnancy. I have itching all over my body. What should I do? So itching all over the body, I would like to know, Bhavika, the most common cause that I would think of is cholestasis of pregnancy, intrahepatic cholestasis of pregnancy, obstetric cholestasis, which is most common during the 3rd trimester of the pregnancy. So, did your itching start from the palms and soles and then moved to the entire body? So, we will conduct a few liver function tests to know whether you are having obstetric cholestasis. If it is present, then we will start you on certain medication which will have a twice a day dosage, and then after a week we need to repeat and see whether the levels are coming down to normal, whether your itching is going down. We also give you certain local application medication so that your itching is controlled and you feel better. But at the same time, we need to rule out other causes of itching of skin, which might include certain infections, which might include certain allergies, which might also include certain conditions which are specific to the pregnancy, and we need to really see whether what kind of rash is present. So if there are some other causes which are locally related to your skin, then we need to treat it accordingly. So it's better that you see your doctor, because if it's an intrahepatic cholestasis, she might have to take a decision to deliver you soon because you're already in your 9th month. If the cause is something else, probably you may not require early delivery. So it's going to be a decision about your delivery, when to deliver you. So it's really important that you see your doctor immediately.